Hi, my name is Paul Thompson. I'm the Associate Director of the Stevens Neuroimaging and Informatics Institute here at USC. And I'm also a professor in neurology, psychiatry, radiology, and biomedical engineering. So today's talk was about the application of artificial intelligence techniques in brain scanning or neuroimaging. One of the ways that you might have a brain scan is if you go to the hospital and you have signs of dementia, or if you've had a brain injury or some other condition that affects the brain. And we often use brain scans to diagnose a disease, to try and understand what are the processes going on in the brain, and to optimize the selection of treatments for someone who has a brain condition. One of the ways that AI can help with all of these processes is to speed up and enhance and inform all of these decisions. Brain scans are images. They're difficult to collect. They use a very high power scanner. AI is actually helping the improvement of the scan quality. If someone was only able to maintain being still in a scanner for less than a minute, normally they might not have a very good quality MRI scan. But with the help of AI, we're now seeing beautiful detail in MRI scans. Another type of scan is called a positron emission tomography scan, can measure the amyloid plaques in the brain and other things like that. So we see AI essentially at the very beginning helping the imaging data as it's collected. A second application of AI in our field, which is radiology and brain imaging, is to make a diagnosis. And so if you have a brain scan, you might have had a stroke or a tumor or a subtle pathology that's very difficult to see. And AI methods can read millions and millions of brain scans, and they can read the radiologist reports that go along with those brain scans, and they can associate very subtle patterns that it's difficult for a doctor to see with signs of illness. Now, are there any issues with this? We would not want to use this on its own. There's no substitute for a physician or a radiologist reading the scan. But this can help the radiologists. They can try these different tools. It can enhance the detection of lesions, of cancer, subtle processes in the brain, and really give them a better chance at detecting things as early as possible. So the last question is, what is the impact of artificial intelligence in healthcare going to be like in the near future? So one of the things I think we will be able to see is doctors are going to have so many tools at their disposal to help them with all of their daily work, whether it's reading brain scans like we do in our area of work, or outside of radiology, it might be making a diagnosis from blood marker data. There could be all of the collected radiologic and diagnostic records from a patient. These are very difficult for a person to take in. There could be an immense amount of information on your disease, on the types of tests that you've had. And AI can summarize this information. So it can essentially read all of the records from you, compare it to other people of the same age, the same gender, and the same background. And we think you're doing really quite well. We think the treatment is working. We think it can suggest modifications to the treatment plan, or it could even suggest new medical tests the person might have. So I think all in all, the AI is a tremendous tool for helping both doctors and researchers and the patients that they see achieve better diagnosis and treatment.